Okay, video 2. We're going to do either in one part or two. We're going to do hamstrings and then the calf. So again, this is all the posterior kinetic chain. And we'll start with the most, well, let's bottom. Let's start with the hamstrings. The insertion for all three of them is the ischial tuberosity, known as the sits bone. Looks like a hoop right here at the bottom of the pelvis. That is, if you're sitting in correct posture, that's what you should be sitting on, not in the middle of the glute. So remember the abbreviation BTM for bottom. It's bicep femoris semitendinosus and semimembranosus. So BTM, bicep femoris attaches laterally. Semitendinosus and semimembranosus attach on the medial aspect. Okay, so that's important to remember. Ischial tuberosity, head of the fibula, that's its insertion. And what does bicep femoris do? Its primary job, as all three hamstrings, is flexion of the knee. Because it crosses from here, it essentially crosses the hip joint because it attaches on the bottom of the hip. It also assists glute max with extension of the hip. Its primary function is flexion of the knee. Its secondary function is extension of the hip. Semitendinosus also is a knee flexor, hip extender, and there is some medial rotation of the knee, but that's not its primary function. It attaches on the pes anserinus and the posterior tibia. Okay? So again, this is going to attach on the medial aspect of the knee. And then semimembranosus, once again, from the ischial tuberosity, comes down like this, attaches on the medial tibia. It is primarily a knee flexor and hip extensor. So if you want to see what they do, hold your leg right there, relax your foot, just hold, resist me. See that fire right there? That's hamstring. Okay, relax. Bottom part of the leg. We're going to start with the superficial popliteus. Begins out here on the lateral femoral condyle and inserts on the posterior tibia like this. It's a very small muscle. It's not a very strong muscle, but it does provide an important function. It unlocks the knee when the knee is at full extension or hyperextension. So the popliteus will unlock the knee like that, which once popliteus fires, then the hamstrings take over to finish flexing the knee. There is some lateral rotation of the femur, but it's not a strong rotator. It mostly serves to unlock the knee. The big superficial muscle in the posterior compartment of the calf is called the gastrocnemius. Its primary job, if you look at the foot, this is the plantar surface of the foot. That is the dorsal side of the foot. Remember a dorsal fin on a shark is what sticks up out of the water. And somebody says they have plantar fasciitis, this is where it is. It's in the plantar surface of the foot. So this, therefore, is plantar flexion. Relax. And this is dorsiflexion. Okay? Plantar, dorsi. Gastrocs' primary function is plantar flexion of the ankle. It is a weak assistant because it does cross the joint. It is a weak assistant to flexion of the knee. It attaches onto the Achilles tendon, which then comes across and attaches on the posterior calcaneus. Do that again, the camera didn't have her foot in line. Gastroc comes down to the Achilles tendon. So again, if you look at a muscle chart, red, white for tendon. So the Achilles tendon comes here, over the back, and onto the posterior calcaneus, okay, so the heel bone. Deep to the gastrocnemius is the soleus. Its primary function is also flexion of the ankle, and it is a weak inverter. Originates on the medial border of the fibula and inserts into the Achilles tendon and then onto the calcaneus. So this is known as a common insertion. We have two separate muscle origins and they come together. So gastroc and soleus have different origins. They come together in a common tendinous insertion. In this case, the Achilles tendon, and they attach onto the heel bone or the calcaneus. Plantaris is a weak knee flexor and a weak plantar flexor of the ankle. It's sometimes called redundant, but it is synergistic to the gastroc and soleus. So it's not a very strong muscle. It begins on the lateral supracondyle of the femur, just superior and medial to the gastroc. So gastroc comes up like that. Plantaris is right up there. Inserts on the Achilles tendon and the calcaneus. Fun fact to know and tell about plantaris: it is absent in anywhere from 7 to 10% of the human race. Sports massage. Again, if this is a pre-event massage, we're going to go nice and quick and light, just getting blood flowing into the hamstrings, gastrocs, soleus. Always nice to work on tendinous attachments. Just rough them up a little bit. That's all you're trying to do, is get blood flowing. Not trying to fix anything, not trying to even heal anything. Just trying to get the muscles ready. If you are post-event, you're going to go a little bit slower. You want to help get the muscle to relax. It's been excited, it's been exerted. You want to get it to relax and return to normal or homeostasis. So slower, deliberate, not a lot of pressure. If this is maintenance, then we're going to do things. I always add muscle testing. The person's telling me that their hamstrings feel weak. I'm going to find out why. Maybe they're having trouble finding them. Most of the time people have trouble finding their glutes. Hold your leg right there. Okay? So there's all three hamstrings firing right there. She can find them. Any pain with that?
Yeah.
Good. This is actually a quad stretch, but if the hamstrings are super tight, sometimes they won't allow this to happen, tell me to stop.
How about right there?
Do you feel that in the front or the back?
The front.
Okay. If a person has knee pain, posterior knee pain, you're going to look at hamstrings, you're going to look at gastrocs, and find out what's going on in here. Plantaris and popliteus are not usually primary suspects if I'm looking at posterior knee pain, but they can be. They do have trigger points like every other muscle. The person is telling you that they're having trouble flexing their ankle. You find out which way, what do they mean, and under what circumstances. So if she's just having trouble getting this to engage and go into plantar flexion, then the calf might be being turned off by another muscle. That's for a later class. Hold your foot right here so you can see that. She's got beautiful calves, right? That's a runner's calf right there. You can see that lateral head and the medial head of the gastroc right there. Relax. Active range of motion, or this is passive range of motion. I'm going to take her into that stretch, and she's going to tell me to stop. This is stretching gastroc and soleus. Good. I'm going to add PNF. We've not talked about that yet. This is one of the mainstays of sports massage. What I'm going to have her do is resist me, but only about a quarter of her strength. This is not a muscle test. What I want her to do is just hold that for me right there. 3, 2, 1. As she relaxes slowly, I continue with the stretch until she says stop. No problem? Good. Do it again. Gently push up into my hand just through your foot. 3, 2, 1, and relax. There you go. So hopefully the camera picked that up. You can see how much the foot flexed, or the ankle flexed even more. So that's PNF, which stands for proprioceptive neuromuscular facilitation. We're going to talk about it a lot in this class. PNF is one of the things that I use just about every day on every single client in one way or another. Active range of motion. I'm going to ask her to push her foot up towards the ceiling. That's active range of motion for gastroc, soleus, and a little bit of plantaris. Relax. Active, passive, and we can do resistive testing. Hold that for me gently. Keep resisting me, but let me win as you come all the way down. It should be consistent all the way through. She's got good control of that hamstring. She did that well. Okay.